Thank you for this opportunity. Costa Rica is a nation of 51,000 square kilometers, a size similar to Slovakia, that is located in Central America. In recent years, it has stood as an emerging country that is a leader on green economic policies. Its economy is based mainly on the provision of services, and in recent years, the installation of industrial zones for the development of medical equipment has become one of the main growth axes. COVID affected every country in the world, and tourism was one of the most affected sectors. The following example helps us to measure the impact in Costa Rica. The main airport received 3.1 million passengers in 2010 and continued to grow, receiving 5.2 million passengers in 2019. During 2020, only 1.6 million people passed through the airport, and therefore, all the rest of the value chains that depends on tourism were affected. What happened in the construction sector specifically? Unlike other past crises, such as the real estate crisis of 2008, this is a health crisis, which affected the economy and therefore affected the investment capacity of individuals and companies. To counteract the effect of COVID, many countries decided to stop productive activities, including constructions. Many commercial activities were stopped in Costa Rica. However, the government decided not to stop the construction sector. Indeed, this was an opportunity for professionals in engineering and architecture to continue with their project and not stop constructions, and the Colegio Federado de Ingenieros y Arquitectos de Costa Rica, CFIA, a WFO member organization responsible of promoting the professional practice of these areas in Costa Rica, took advantage of this window of opportunity. The construction sector represents 5% of the economy. On average, it has registered more than 10 million square meters of construction intention in recent years. To carry out a construction in Costa Rica, it is necessary for an engineer or an architect professional to register his project through the online CFIA platform. On average, 45,000 construction registrations are made per year. The image summarizes two crises that the construction sector has experienced in less than 15 years. This is the total of square meters that we have registered in the history, and you can see between 2008 and 2009 that the fall of minus 38% that was produced by the crisis of the real estate business in the United States, which affected our economy. And then you can see the crisis of 2020, which reduced minus 26% the quantity of square meters that we registered. Of those registrations that are made, the highest percentage of the square meters corresponds to housing. Given the natural growth of the population in Costa Rica, there's a need to generate 25,000 new spaces per family per year. It is important to clarify that not all construction registrations that are carried out in the country correspond to new constructions. In many cases, they are for remodeling or expanding existing works. In the case of housing, in recent years, new construction represented 77% of all registered square meters, and the value fell in 2020 mainly due to the decrease of the economic capacity of people who could build a new house. In the commercial sector, this impact is stronger, and it suffered closures or restrictions on its operations. In many shopping centers, the vacancy rate exceeded values of 10%. This will cause that, for some years, the new construction registered will not grow, since there are enough commercial space built, and they will only have to adapt to the new use that it will have. For example, to enable a space used as a store to be used as a restaurant. During 2020, the main reduction that occurred is that the Ministry of Public Works. The country had to redirect many of its investment towards systems of aid or assistance to economic sectors that were directly affected by COVID. This condition would generate problems with the future constructions. Of those 45,000 records that are received on average per year, only 5% of those has a dimension greater than 420 square meters. In larger works, the country regulations require the permanence of an occupational health professional engineer within the project. These are professionals that, due to their academic training, can implement adequate prevention measures to avoid the spread of coronavirus. Thanks to the experiences in managing data, the Sophia makes the decision to prepare documentation for small works, less than 400 square meters, so that leading professionals can provide construction workers with technical information in simple language that could be implemented with accessible resources. Now, I would like to introduce you to my colleague, Andrea ChacónIng. She's a health and safety engineer, and she will address the technical details behind the manuals and their importance for the process that I've just told you about.
Thank you, Marcial. As you just mentioned, CFIA developed 3 guides for the implementation of prevention measures against COVID-19 in the construction sector. For the development of this guide, we worked together with professionals in engineering and architecture, as well as with government entities such as the Ministry of Housing. The first guide is called Guide for the Implementation of Prevention Measures Against COVID-19 in the Construction Sector. Constructions smaller than 400 square meters. This guide focuses on developments on less than 400 square meters of construction, especially, as indicated previously, seen as part of the studies carried out. It was observed that around 90% of the constructions registered with the CFIA were smaller than 400 square meters. This allowed us to focus our documents mainly on those constructions, as land building projects probably had a department and a professional in occupational health engineering. These guides propose some of the following guidelines: an admission protocol, which includes a small admission questionnaire, hand washing and temperature check, physical distancing at all times, especially when greeting, eating, or carry out work activities, the use of staggered hours that, in case of having a positive COVID case in the work areas, will allow for a part of the teams to be removed and not the entire team, constant training in personal hygiene and hand washing. The second guide is called Guide for Implementation of Preventive Measures Against COVID-19 in the Construction Sector, Work Inspection for Professionals. This guide was especially focused on professionals who should continue to visit construction sites as part of their work. This document included a verification table to find out the minimum prevention and protection requirements were met during the inspection. Some aspects covered by the guide were the protocol for entering the project site as a visitor, the handling and use of personal protective equipment, physical distancing, the measures to take into account when eating, prevention to disinfect objects or equipment that could be contaminated. The third guide is called Guide for the Implementation of Prevention Measures Against COVID-19 in the Construction Sector, Engineering and Architecture Offices, with the goal of giving continuity to the business and the strengthening of engineering and architecture in Costa Rica. This document was developed to aim at cover the main prevention measures against COVID-19 within offices, areas, and facilities used to offer engineering and architecture services. Some of the aspects covered were cleaning of offices and warehouses, the use and handling of personal protective equipment in offices, safe use of elevators and offices equipment, and work from home as an alternative to avoid occupational exposure to the SARS-CoV-2 virus. With these 3 documents, it was possible to reach professionals and collaborators in all areas associated with the economic activity of construction. To reach the most vulnerable people of the economic construction activity, the CFIA developed joint efforts with various entities to offer different informative materials: banners, lectures, flyers, brief informative spaces. In the same way, streaming was made through the different CFIA social media to bring timely and appropriate information to the entire population, especially in the construction sector. There were also forums for the development of alternative solutions for the implementation of preventive measures. The information was provided to all construction actors to make sure no one was left behind. To achieve this object, outreach and training activities were carried out in conjunction with various organizations, including the Ministry of Housing. Among our main strengths, we have several that we can mention. In Costa Rica, we have a strength that, unlike other countries in the region, access to drinking water is mandatory in all the constructions. This allows to have access to hygiene and hydration, which are core aspects when speaking of the pandemic. Another advantage is that Costa Rica counts on professionals in the field of occupational health which are incorporated into the CFIA. According to the regulation and legislation, after 50 people working on a construction project or any company, there must be 1. A professional in the area of occupational health engineering. 2. An occupational health department. 3. An occupational health commission. This organizational structure facilitates decision-making and the timely analysis of solutions for the implementation of preventive measures against COVID-19. Proactively, CFIA creates a support email to address the doubts and concerns of professionals from companies with less than 50 employees. Now, what will be the challenges in 2021 in our professions? 1. Maintain safe behavior on our work sites. Do not let your guard down. It's very important to understand that some protection mechanisms, such as vaccination, which currently occurs worldwide, is only a means to protect the most vulnerable people according to the effect of exposure, probability, and consequences from the virus. This is not in itself the solution to the problem. The solution is built on safe behavior, efficient hygiene protocols, and awareness of the population to maintain high level of safety and health in our work centers and in different living environments such as recreation, family, or others. 2. Develop new technologies to improve indoor air quality in closed spaces. Undoubtedly, the opportunity to develop new technologies to improve indoor air quality in closed areas will be one of the challenges that engineering and architecture professionals must take into account in their design and their various projects. And the point number 3, seek the best level of protection for our working population in terms of personal protective equipment. Achieving the development of respiratory protection mechanisms and personal protection equipment that are more comfortable, ergonomic, and that meet the basic protection needs with an affordable value will be a challenge for each of the countries in the world. We must not forget that for this challenge, engineering professionals from all over the world must be directly linked and committed in the achievement of all possible solutions. This is an exhortation to continue working for global health from our professions. Thank you.